Welcome back, friends, to TV5 News at 9. Joining us this morning, a real treat, Dr. Christian Hyde. Thank you so much for being here. How are you, doctor?
I'm doing great, thank you. How are you?
I'm doing well. Thank you, doctor, so much for asking. Today we are talking about gynecologic cancers. Now, what are some of the common gynecologic cancers, doctor?
Yeah, so ovarian cancer is a common GYN cancer. Uterine cancer, or more specifically endometrial cancer, which is the lining of the uterus, is a common GYN cancer. And cervical cancer is another common GYN cancer. And I'd say that's probably the vast majority of the GYN cancers that we treat.
And doctor, why might some women be at greater risk for these cancers?
Sure. So let's talk about cervical cancer for a minute. That one is pretty well understood as far as some of the causes. One of the causes is a virus called HPV, human papillomavirus. And there's been some press about it for years now because there is a vaccine, the HPV vaccine. If given to people before they're exposed to the virus, which is usually a sexually transmitted virus, that can help prevent infection that can last for decades and gradually lead to cervical cancer over the course of time.
Now, doctor, what causes some of the other types of GYN cancers?
Sure. So smoking is another risk factor for cancers in general, and cervical cancer in particular. One of the other common cancers we talked about was endometrial cancer of the lining of the uterus. And that one is linked to obesity, carrying around too much weight, especially patients who are really heavy, over 200 pounds or more. That risk goes up. And part of that is because our fat cells make estrogen, and that estrogen can cause the lining of the endometrium to overgrow. And that overgrowth over time can cause changes that lead to abnormal growth that sustains itself and eventually becomes cancer.
And doctor, why might proton therapy really be a good treatment option for the GYN cancers?
So proton therapy is a newer type of radiation. It's different than the old X-ray beams. The X-ray beams, they go in one side of the patient all the way through and out the other, whereas the proton beam goes in where we want it to go and it stops. Now that's a really big benefit when we have to treat a lot of lymph nodes. Lymph nodes are like filters in the pelvis. They catch bacteria and viruses and other things that our bodies are exposed to, and they provide an opportunity for the immune system to come in and start attacking those abnormal cells. And they also catch cancer cells and kind of filter them out in the lymph nodes. And when cancer is in the lymph nodes, we have to treat a bigger area. We can't just treat the cervix. We can't just treat the uterus or the lining of the uterus. We have to treat a big area of the pelvis. And the problem is that the pelvis is like a bowl or like a dish, and inside it is the uterus in the middle. But there's also, the bladder and the rectum and the small bowel kind of falling down into that bowl. And if you give x-rays through the pelvis, you're going to hit everything in between. You're going to hit the small bowel, you're going to hit the rectum, you're going to hit the bladder. Whereas if we use protons, we can treat the lymph nodes, which are kind of on the sides, right next to the sides of the pelvis, but not in the middle. And so, the beam goes in, it hits the lymph node and it stops. And the beam goes in the other side and it hits the lymph nodes and it stops without going all the way through the middle. And that's the big benefit, is reduction of side effects. That's really the number one difference between x-rays and protons, is when we're treating a big area of lymph nodes, we can reduce the side effects of the radiation because there's less normal tissue that we're treating through.
That seems like
so
a great option.
Let's say you have cervical cancer and it's gone to some lymph nodes, maybe even above the pelvis. Maybe it's up by the kidneys.
Yeah.
That's a really hard area for x-rays to treat without hitting the kidneys or the intestines. So the more lymph node spread there is, the better result you're going to get with side effect reduction from proton therapy. So not just advanced tumors that have lymph node spread benefit from proton therapy, but also patients who have their cancer come back. Maybe they had surgery and their cancer came back, or maybe they had radiation before and their cancer came back, and now we're looking at re-irradiation, which can be dangerous when you're using x-rays and you're treating a big area. You really want to be as focused as possible, put the radiation just where it needs to go, and proton therapy is really helpful when it comes to reirradiation, because that we can make that beam stop in the tumor and not keep traveling into the healthy parts of the body.
Yeah, it seems like very targeted therapy. So how can patients find out if proton therapy may be right for them?
Sure. So every patient is different. I'm glad you asked. Proton therapy is not for everyone. The way to really find out if it's right for you or a loved one is to give us a call, and we can meet with the patient. We can talk about the different options, the pros and cons of each of the options out there. The contact information I'd recommend is to call our navigator at 855-MY-PROTON. That's MYPROTON, 855-MYPROTON, MyProton, or on the web at mclaren.org/proton treatment, all one word, mclaren.org proton treatment.
Dr. Hyde, is there anything else, any message that you'd have or anything lastly that you'd like to say to viewers out there?
Yeah, just that, the word cancer is scary, and some patients just kind of wish it would go away, put their head in the sand, but, there's a lot of reason for hope. We have cures now where before we didn't have cures. Even just within the last 5 years, there's been a lot of developments with immunotherapy and proton therapy. Things that were in the laboratory before are now in the clinic, and so there's lots of reasons for hope.
It sure is. It's definitely, cancer is not a death sentence. That is a great message. Thank you so much, Dr. Hyde, for this information. Appreciate you calling in.
You're welcome. Thank you.
Of course, you are so welcome. Thank you again for watching. You can find out more information in the hot link section at WNEM.com.